wrote this letter first to express our support, to acknowledge what you have done, and to assure you that if the time comes for us as a country to even declare a lockdown, we will support you. We also drew attention to the fact that a number of our people are poor. And so the measures that we have put in place, including the wearing of nose masks, sanitizers, and so on, quite a number of our people cannot afford. Therefore, we were urging government to, if possible, provide this free of charge to everybody who cannot afford, or subsidize it so that everybody can have access. So those are the two important issues that we raised in the letter. But we have followed the news after that. Some are even saying we are blaming President for the spread of the virus. That was not the intention at all. We wrote to express our support and to assure you that we will be with you, and we also pray for you. We wish that God gives you the courage, the wisdom, and the good health to lead us out of this crisis. We know that we will not remain this forever, and we are sure that you will also can count on us as workers, leaders, and of course, we need to engage the social partners, because if the time comes for us to lock down, what it means is that employers will have a role to play, workers will have roles to play as individual workers, and trade unions also will have a role to play. And the government is already playing a fantastic role. That role will have to change. So that was the essence of our letter, and we thank you for inviting us to hear us. We are hoping that if the ministers are around, we can also go back to our people who are waiting for us and have something concrete to tell them. Thank you very much, Your Excellency. Thank you, Honorable Ministers. Thank you, colleagues.
First of all, let me welcome all of you to the seat of government in our country, to Jubilee House, and say how much I welcome this meeting. I'd hoped that we would have the meeting on Tuesday. When I got your letter on Monday, I asked for us to have an immediate meeting because I thought the issues you were raising were serious, as they should be, and therefore it needed for us to engage immediately. Unfortunately, it couldn't be possible. I think all your people were not around on Tuesday. Yesterday was a day of Prez, so I tried to, as much as possible, limit my engagements, and that's why we've had to meet today. But it's still not late. Really, I appreciate very much the expression of support that you put both on paper. I've re-echoed this morning, and I've heard in the newspapers the support that you have given to the measures that we have taken so far. All of these measures have one aim: as much as possible to limit the spread of this disease within our community, find a way of containing it, and hopefully suppressing it so that we can get on with the normal social and economic life of our country. We are under constant review. We're looking at measures that we have taken and constantly reviewing them to make sure that we're abreast of the issue and can provide an effective antidote. For instance, it's clear that the measure we took to close our borders, ban international travel, and in the immediate aftermath of that banning, everybody who came to Ghana had to be subjected to mandatory quarantine as well as testing. At the time, there were a lot of comments, many of them unhelpful. But at the end of the day, I believe that the decision to ban international travel as well as to take the measures of quarantine and testing are being vindicated by facts. It turns out that the overwhelming number of cases confirmed in cases of infections that we have in Ghana are all from people who came from abroad. And of those who came and have been quarantined, an extreme number, some over 50 odd, have been found to be carrying the virus. So focusing on the importation of the virus and the infection has proved to be absolutely spot on. And we are now seeing the benefit of these measures. But we can never stop there. We have to constantly look at whatever additional measures are there that will put us in a strong place to deal with this pandemic, this menace. And that is what we're constantly doing. So I took your letter in that spirit, that we recognize the efficacy of some of the measures that have already been laid out, and now we're looking for additional measures to make sure that we could contain this virus and ultimately suppress it. So I want to assure you, it didn't come to me as some sort of criticism or undermining or of the position of government. That is not the way I took it in any event. I saw it as a very helpful expression of support. Whatever we do, people are talking now in Ghana about a lockdown, this and that. The majority of people who will be affected by decisions of that nature are the working people of our country, the ordinary people of Ghana. They're the ones who will be most affected. And it is important for us, when we're taking these decisions, to take into account their circumstances and conditions. You're going to lock down Accra. What are the consequences? You're going to lock down the country. What are the consequences? Or particular areas of the country. A government, a responsible government, is required to look at all the implications before decisions are made. And that is the exercise on which we're currently engaged. And I'm hoping that much sooner than later, we will come to an agreement within government of what those measures are. And then the Ghanaian people will be informed. But I want to assure you that the matters you have put on the table are matters that we are actively deliberating, considering, and that we will continue in the spirit in which we have so far taken these measures of making sure at any one stage that we are abreast of the issue and are taking measures to be able to contain it. I've indicated to the country the various main objectives of our policy and of our response. Limiting the importation. We've taken some important steps towards that objective. Trying to contain the spread of the virus. Making provisions, strengthening our capacity to care for those who are sick. Limiting as much as possible the impact on our social and economic life of the incidence of the pandemic. And then also trying to find a way to use this crisis as an opportunity to strengthen our nation. We've seen how dependent we are on foreign imports for our medicines, for the various pharmaceutical incidents that we need to have to cope with this. That shouldn't be the case. But that is the reality after so many years of, if you like, neglect. We're finding our capacity to produce things for ourselves in this crisis severely limited. What do we do? How do we overcome this limitation? It should be one of the objectives of policy at this stage, that we find a way to strengthen our domestic capacity across the board and move into a greater stage of self-reliance. These are the key parameters that are governing government response to this crisis. And it's important that we have this opportunity to exchange views and agree on some steps.